I think one of the most important things that people neglect, a lot of people, they know that core stability is important. They know that hip strength is important. A lot of people, I think, ignore upper back or mid-back thoracic mobility. This has a huge impact on a wide variety of my patients. I think it's one of the single best things that people can do generally for their health because it'll affect multiple things. Having a more mobile mid and upper back will improve neck pain, it'll improve low back pain, and it'll improve shoulder pain. If you've got limited shoulder motion, let's say, so I'm a little limited there, but better than many. If you think of that little old lady who's hunched over, she's got the cane, if her back doesn't extend, so if I'm fixed in this position, over time it gets stiffer and stiffer, my arm will not go higher than this. So I run into my end range every time I reach for that coffee cup. Rather than working this area, which that's where the pain is, so many people want to do that, getting this to move is the key. My arm will just naturally go up if I get some thoracic extension. Easiest ways to do that with a foam roller or take tennis balls. Some people use lacrosse balls. I think that's kind of intense. Tennis balls are very effective. If they're dog chewed, they're even a little more comfortable. And they sell little peanuts and that kind of thing that you can buy with the same goal. But what you're going to be doing is laying over it like this, right? Would recommend supporting your head. And you've got two options. You can roll. And usually I tell people think about like bra line or so. You're not going all the way down to your low back. Most people's low backs are already moving too much compared to their upper back. And you're just trying to get this to drop. Keeping your belly's going to be tight is important. You don't want to let all that motion come down here, so you keep yourself a little tight. And you can either roll up and down, arms in or out, whatever feels better to you is fine by me. Or you can kind of sit there and keep yourself a little tight and almost try to pivot over that roller. I find the roller to be very effective. It tends to be more comfortable. Where I like take tennis balls more is for the stiffness that's really high up here. Neck pain in particular. If this starts to curve down, that neck has to come like this to be able to see the world. If it was in a good position, you'd be down here, but you'd be looking at the floor. So getting this to extend is what's going to give us our better posture. The roller's too thick to really fit in there, so taking the ball right where this little gap is, and you're going to go on either side of that little bone down the center of your spine that you can feel. It's a little awkward to set up initially. For many people, I recommend a pillow so your head doesn't end up in too much extension. And rather than rolling on these balls, you're just going to lift your hips up. And that gets that pressure down into the balls, and it's a way to mobilize those joints. It's different than putting one ball down there and rolling against the wall of the floor. We're not working on muscles, we're working on joint mobility. And there's a fair amount of pressure there. For some people, this is very uncomfortable. Some people think it's the greatest exercise ever. They like that pressure. So you do a couple lifts, 3, 5 lifts, and then you scoot up an inch. And that brings that ball down to the next vertebrae, and you're going to work that. As you get further and further up, the hip lift is a little less important because you get more of your body weight over it. So it's totally fine if this is kind of intense for you to just sit there and breathe on it. And every breath you take will help mobilize your spine. This is probably one of the more effective ways to get some thoracic mobility, which will help give you some relief to your shoulder pain, very much your neck pain, and even your low back pain. So we want to help stabilize the low back, but we want to make the things that are stiff move more so everything evens out. Thanks.